So we do a mic check. Are y'all okay? You need some more?
Yeah. Let me just put this right up here.
Okay.
All right.
I'm gonna talk about my glasses. I'm good.
I have a pair, but I don't know if they work for you.
No, we're good. We're good. We certainly appreciate everybody being here today. As you can see, I'm being joined by the County Commission President, Jerry Carl, by Councilman John Williams, and by the President of the Southwest Alabama Community Foundation, Rebecca Byrne. And each one of them will make some remarks today. I would start off by saying that Ms. Byrne is going to speak to a disaster relief fund that has been created. I think that everybody's going to be very interested in that. Commissioner Carl will talk about collaboration that's actually started previous to today, but Commissioner Carl joined the city in a meeting so to make sure that kind of the left hand, right hand knows what's going on, sharing of information to make sure we're more efficient in the services that we're providing and the challenges and addressing the challenges that we're all facing. Additionally, Councilman Williams will just have some off-the-cuff remarks that he would like to make. I'll say this, that when it comes to the Disaster Relief Fund, we recognize that once the federal government is engaged, that there will be monies that are trying to flow down to those individuals, entities, companies that are in need of that money, but always there's somebody that falls through the cracks. We also know that there are individuals and companies that if there was a vehicle for them to make contributions, that they would contribute to a fund if it was properly distributed to those in need, that they would be glad to make those contributions. And so that's what the Disaster Relief Fund is about. So I will let Ms. Byrne tell you about the Disaster Relief Fund.
Good afternoon. The Community Foundation is uniquely positioned to establish a fund to address disaster relief. Many of you may be familiar with community foundations. Can you hear me? That are all across the country. And one of the benefits that we have is that that's what we're established to do, is to address issues that are pertinent in the life of the community. And certainly right now we are all experiencing this pandemic, and we have the opportunity, because there are community foundations all across the country. We're part of a network, and we're able now we're sharing information and looking at other community foundations who have already established funds in their community. For example, Seattle, which has already been hit very hard, and some other cities as well, who've set up funds to address this issue. So we will be looking at them for some of their guidance, collaborating with them. The mayor and I and some others over the course of the last couple of years have discussed the collaborative effort that we can do moving forward should there ever be a disaster in this community. So we've had the benefit of having some conversations. Obviously, we did not know that we would be facing this today, but because of that, we were able to discuss some certain things. And what we're looking to is to establish a fund sometime in the beginning of next week. We'll provide some additional information to you as to how individuals, companies, others can make donations to this fund. So moving forward, we can help those, as the mayor just said, who are falling in the cracks. Thank you.
I would point out this is not an endowment fund. I would say, kind of to use an example, if we receive $100,000, there will be $100,000 distributed over some period of time, but it's not to build up and to be used for future disasters. And that separates it from maybe other types of funds. Today, during our citywide meeting where we are teleconferencing, we've talked about several things that are occurring. One is that there's a tremendous effort going on in Build Mobile and also Visit Mobile. The Build Mobile part has to do with making sure that those that want to do business with permitting and licensing, that they can do that. And I know that we will get better at being able to do those things online. Our revenue department is going to make sure that they're doing a better job of being able to contact those that are interested in the business with the revenue department. Visit Mobile has become the place to go to find out about cancellations. So if you are an organization and you are either going to have an event, postpone an event, reschedule an event, Visit Mobile is that area that you need to go to. Earlier today, as I said, Commissioner Carl came and joined our meeting to see how we're handling just the procedures of working the meeting. So I'll ask Commissioner Carl, or President of the County Commission, Jerry Carl, to make a few remarks now.
Good afternoon. We started actually last Friday. Our staff worked over the weekend putting some plans together. Today, early this morning when we got together, we really did not want to duplicate a lot of things. So the city has agreed to allow us to sit in and share information through their systems also, which we're excited for that. If we do our job right, there will be 0 outbreaks in Mobile, and then you can say that we overplayed our hand. If we don't do our job right, we will have problems. So we're trying to be proactive here. So be very patient with us. We have several things that are happening today. I know there's some stuff came out earlier today about our restaurant industry. Let's support our restaurant industry. Let's not forget our small businesses in Mobile. They may be limited in what they can do, but what they're limited in what they can do, let's get out and support them. We have every intention of keeping you advised on this from a county standpoint. I think the mayor has got to jump on us as far as having it organized, and that's great because we'll be more than glad to back him up in all these conversations. So one Mobile County, one South Alabama. We'll do this together.
Thank you, Commissioner Carl. With everybody watching the TV, paying attention to the news media, you know there's really 3 things that we're doing, and that really is encouraging good hygiene, washing the hands. And we can't say it enough. The social distancing, you notice that Ms. Byrne is pretty good at, and I notice the media has done a much better job today with that also. But it is important. It's very important, or you wouldn't be hearing the President of the United States talk about what they're trying to do, controlling crowd sizes and the distancing. And the other thing that we're telling everybody, especially city employees, if you're sick, stay at home. If we do these things, it will certainly shorten the timeline of this and maybe flatten the curve of the numbers that we have that will be impacted by this. At this time, I'd ask Councilman Williams to make a couple of remarks.
Thank you, Mr. Mayor. It is a great day in Mobile, Alabama. And I see some faces change a little bit, but the truth is, it is a great day, and it's a great day because we are well led. And it is a great day because we have professionals, not only on the city staff, but throughout, representative of Ms. Byrne here, throughout our community in many capacities that are ready and equipped to handle whatever challenge that we face. Ladies and gentlemen, there has been no lack of communication between the 9th and 10th floor. We are staying in touch and staying abreast of all that we know. But one of the things that we must call on is patience and the ability to deal with changing situations. As we get better knowledge, we are going to change our minds in some way, in a positive way, that is going to impact this community and make sure that we are doing all that we can. One last thing, and that is that the council will continue to meet. Today, the governor gave us the authority to meet using telephones during certain situations, and we're going to work through that in the coming days. If there are any questions at all, and you cannot reach the city government, we ask that everybody follow the guidelines of the CDC. We're trying to do that in conjunction with the governor's office, mayor's office, and we just simply need cooperation. Thank you very much.
So, good point. Everybody needs to know that we are following the CDC guidelines. There are some questions about why don't you do this and why don't you do that. Well, at this point in time, I can assure you that we are following the guidelines as they have come to us. The biggest challenge we face right now is the number of tests that we need. We have so many citizens that want to be tested, and the tests aren't available. The city is not responsible for those, for having the procurement of those tests, but that is the biggest challenge. If you listen to the heads of the hospitals, them trying to set up locations, off-site locations, so that people can be tested, but we can't do it without the testing equipment. And that comes back to the Mobile County Board of Health. The last thing that I would say is that, I'll give you an example. I had a phone call from an organization that takes care of children and the elderly. They're feeding something like 120 of our elderly almost every day, 5 days a week. And because of the changes that are going on, they had no way to deliver meals. And they let us know that. And so we turned to put that word out within the city departments. And the next thing we know is Parks and Rec stepped up and said, we have a way to deliver those meals. So when you have a door closed, there's somebody there to open that window. And that is what's going to continue to happen to move our community forward, is it's always happened that way. Yes, there are going to be struggles, but yes, there's somebody out there to help you. We're going to facilitate that, and tomorrow we'll be better at it than we are today, and the next day we'll be better than that. So my encouragement to you is, don't let the fear of the unknown keep you from doing what we need to be doing. So I'll be glad to answer any questions if anybody has any.
Mayor,
yes.
I've just got one question.
Yep.
With Commissioner Carl, 70% of our downtown businesses
yep.
are supported by single-family mothers. Is there a way to take the reserve from the hotel-motel tax and put it towards your fund and redirect that fund to help those people who are going to lose a paycheck now that we're shut down?
Well, I would say that there's some things that not possible, but until we maybe delve into them, we don't know the answers. And I wouldn't want to speak for Visit Mobile or how they're going to use their funds. They are in direct communication with the hospitality organizations. They know what they can do to help, so that decision should be left up to them.
Can we visit that?
Yes, with Visit Mobile. Yeah. Yeah.
That could help these single family.
Yep. Another question? Yes.
Yeah. How will the Dr. Eisel's order? How will that be enforced? Will the Mobile Police Department enforce that?
Health Department enforces that.
Okay.
Your reaction to that is something I know you're talking about being difficult to happen, and maybe this fund would help people because people work for us.
Well, as we work our way through the situation where we are, we have to be supportive of each other. And so Dr. Eichel has the authority to do what he did. That is not what I would have done. And I'll leave it at that.
Mr. Mayor,
yes. We have worked with the Mobile County the Mobile County Personnel Board to address that question. There is a sequence that they go through, vacation, sick leave, and I'm not sure the exact order, but there is a very well-defined process of if they're home, how it plays out and how they're paid. But I'll say this, that we are going to do our very best to find things that that need to be done, that could be done by a city employee. And let me give you an example. It may be that somebody at the art museum may not have as much to do as they previously did. But if somebody in the parks area needs the assistance and the person in the art museum happens to have those skills, we're going to see how we pair all that up. And we're actually making a list of the needs that are developing versus people that could have the time to address those needs, and see how we pair that up.
And the question I feel like all of our newsrooms are being inundated with that I would have asked Mr. Eichel is, how can people get tested? What is the update on that?
Well, I'm going to answer it this way. We've got to get the test in the city of Mobile first. and then it's up to the health providers, the health department, working with the hospitals and so forth to do that. We're willing to set up, when we're fire rescue, we've set up places where people can be triaged, but there is I would say a conversation or a battle going on to get the test kits. And other places are getting test kits, and Mobile is not getting them. And I just wonder if our voice is if it's being expressed that we need them. That's my concern.
How do you go about doing that?
My hope is that Dr. Eichel understands that he's the point person on that and that he'll make it happen.
Where is he?
He's not here.
Well, what do you think the reason is that Mobile has been, quote, ignored as far as getting tested?
I don't know the answer to that.
My understanding is that individuals over 60 that have city charges are going to be able to be released on their own recognizance bond because of this. I just want to see if there was you had a comment about that procedure.
I have to call on Director Barber. I'm not sure of that. Can you repeat the question, Dale?
I'll try. My understanding is that individuals over 60 years old who are in Metro Jail will be released on our recognizance bond to avoid problems with COVID-19. I just wanted to see what you could tell me about that.
Yeah, that has to do with the Sheriff's Department, but I've been in constant communication with the Sheriff about this. But inmates that are on misdemeanor charges, that are nonviolent, that are 60 years old, because of the at-risk factors of age, are being released on their own recognizance, as well as anybody that presents with some chronic illness that would make them more susceptible to corona. And so those are happening, as well as the City of Mobile municipal court system is looking at alternatives to physical custody of a prisoner on nonviolent misdemeanors in the issuance of a summons at a later date, rather than take them into custody and transport to the jail. So those are underway. We've thought very much about that because of the crowded conditions at Mobile Metro.
All right, time for another question.
Jerry, do you have something you want to say?
I do. When we talk about the test kits, I mean, that's fine. They will tell us if you have it or not. But the symptoms, the best thing to do is go home and self-quarantine yourself. There's no treatment for it. If you're over the age of 60 or if you have a weak immune system, obviously you are potentially could address some much more severe problems. But most people, it's going to be simple runny noses, flu symptoms. Go home and quarantine yourself. A test is only going to tell us if you have it or not. The tests are not available right now. So if you have it, don't flood the hospitals, don't flood the doctors. Go home, call your doctor, tell him what the symptoms are, and let him try to coach you over the telephone. Okay? Well, you say a lot of people. There hasn't been a lot of people. I mean, there's been a few people, but people just going for the sake of testing, you're wasting a test that could be used on somebody that truly needs it. So if you don't show any symptoms and you don't feel any symptoms, don't go just take a test because you can take a test, because you're wasting it when we need it on someone that truly we're trying to determine whether to put them back to work or put them back into a daycare situation or back with their children's situation. So we need to save those tests as much as we can and use them where we truly feel like we need them until we have plenty to go around. But just to test to be tested is not a good modality right now.
I have one more question for the mayor, as usual.
I got a text from him saying that he was getting ready to do it. So regarding the test kits, the federal government was controlling all of them at one point in time. The decision was made to let private industry now produce them. So you will see a flood of these tests, and it was a 72-hour test. You're going to see something much more efficient, and within probably a week, I'm guessing at that a little bit, within a week or so, there may not be this challenge of not being able to get the test kits. Certainly, it's going to change because of the availability.
They didn't tell you how many you might be getting to start opening up.
I do not know. No. All right. Thank you very much. Thank you.
So we should be seeing this say, well, we're going to provide like the utility. We're going to provide the site. We're going to leave, we're planning the site. We're planning the site.
I know we do y'all about everything.